Okay, imagine this scenario. You've got this incredible champion mare. Let's call her Blaze of Glory. She's just winning everything, right? Peak of her career. Now picture her having a healthy foal, but without ever missing a race.
Wow, okay.
Or maybe think about a beloved mare, foundation of the breeding program, but she's got a medical issue. Carrying a foal is just too risky for her.
Yeah, that happens.
And yet she still manages to pass on those of amazing genetics. Sounds kind of futuristic, doesn't it?
It really does sound like a revolution in horse breeding. And, for a lot of breeders, it already is.
Welcome to the deep dive. This is where we take your curiosity and, well, turn it into understanding you can actually use.
Yeah. Clear, actionable understanding.
And today we're diving right into that revolution you mentioned, the fascinating world of equine embryo transfer. You'll often hear it's called ET.
That's right. And our mission here today is really to unpack this pretty sophisticated technique. We want to explore why breeders even use it, walk you through the process step by step, and it is intricate.
Yeah.
And really get a handle on what it means for the future of horse breeding.
So you're basically going to get a shortcut to being really well informed about a practice that's honestly transforming how valuable genetics get passed along in the horse world.
Exactly. And we've looked at some great sources to help guide us, like Equine Embryo Transfer, a comprehensive guide, and another one called Equine Embryo Transfer, Procedures, Care, and Prognosis. Really solid info.
Okay, so let's start right there then. Why would someone even consider something that sounds, frankly, pretty complex like embryo transfer for their horses? What's the real pull?
That's a great place to start because it's more than just convenience.
Yeah.
It's a fundamental shift. Think about your Blaze of Glory. Traditionally, she'd face this awful choice, right? Keep competing or take time off to be a mom.
Yeah, lose a whole season, maybe more?
Exactly. ET completely separates those two things, reproduction and performance. She doesn't have to choose anymore. That's a massive change for managing these high-value animals.
So Blaze of Glory keeps winning races, and meanwhile, her foal is developing safely in another mare. That really does sound like a game changer, maximizing her value on both fronts.
Precisely. And it goes beyond that. For mares with, exceptionally valuable genetics, ET means potentially getting multiple foals in just one breeding season. They call it serial flushing.
Multiple falls in 1 year.
Yes, or just significantly more foals over her lifetime compared to carrying each one herself. It just speeds up the genetic progress you can make in a specific bloodline. Massively.
Okay, and what about those other mares you mentioned? The ones with health problems, the ones who maybe can't carry a foal safely.
This is where ET is it's a lifeline, honestly.
Yeah.
It opens the door for foals for mares with chronic uterine issues, maybe cervical damage, things like that.
Things that would normally stop them breeding.
Absolutely. Or mares with health risks where pregnancy itself is dangerous, like severe laminitis history, or maybe past colic surgeries. ET lets their genetics continue when otherwise that door would be closed.
That's huge. It completely changes the outlook for that mare.
It really, really does. And, there are other benefits, too. You can breed younger mares, get offspring from them before their big performance career even starts, or without interrupting their growth.
Without putting that stress on a young, developing horse.
Right. And just fundamentally, it reduces the risks that come with pregnancy and foaling for the donor mare herself. That's a big safety factor. Oh, and sometimes, rarely, if a donor happens to produce twins, which is usually risky for a mare to carry.
Yeah, twins are often bad news in horses.
It can be. With ET, you could potentially transfer one embryo to a different recipient mare, so it helps manage that situation too.
I think I read somewhere about some, well, even more surprising uses, like pushing the boundaries a bit.
Oh, for sure. The technology itself is versatile. It's been used for what they call extra-specific matings. Think about transferring a zebra embryo into a regular horse mare.
A zebra embryo. Seriously.
Yep. And it's worked. It just shows the potential of the technique, beyond just breeding within the same species or breed. It's pretty amazing stuff.
Wow. Okay, that definitely pushes the boundaries. So let's get into the nitty-gritty then. You said it's intricate. This isn't just like swapping an egg. It sounds like a really precise dance.
It is. Precision is everything. It all starts, naturally, with the donor mare, the one with the genetics you want. First step. A thorough breeding soundness exam, or BSE.
Okay, health check.
A really comprehensive one. Palpation, ultrasound of her uterus and ovaries, maybe cultures, cytology, even a biopsy sometimes. Just making absolutely sure she's capable of producing healthy embryos to begin with.
Like a pre-flight check before a really important mission. Makes sense.
Exactly like that. Then you monitor her heat cycle, her estrus cycle, very closely. Ultrasound, teasing, the works, to pinpoint the perfect time for breeding.
Natural cover or AI?
Either works, natural cover or AI with fresh, cooled, or even frozen semen. The key is timing it right near ovulation. Then, daily ultrasounds confirm exactly when she ovulated.
Right.
That day becomes day 0.
Day 0. Got it.
And sometimes, depending on the mare, maybe 4 or 6 hours after breeding, they might do a uterine lavage, a gentle flush, or give oxytocin just to help manage any inflammation. Keep the uterus happy.
Okay, so she's bred, ovulation confirmed, day 0. Then what? When do you actually try to get the embryo?
That happens with the embryo flush, the collection. It's typically time for 6 to 8 days after day 0. So day 7 or day 8 post-ovulation is really common.
Why then specifically?
Because by then, the embryo, if there is one, has developed into a tiny blastocyst. It's moved down into the uterus, but it hasn't implanted yet. And it's still microscopic, maybe 200 to 800 microns, smaller than the head of a pin.
Wow. Okay. And how do you flush it out?
Carefully. First, thorough cleaning of the mare's perineal area. Then a special sauce catheter, usually a Foley catheter, is gently passed through her cervix into the uterus. It has a little inflatable cuff that creates a seal at the cervix. Then, several liters of warmed, special embryo-safe fluid, like a modified buffered saline with serum and antibiotics, are infused into the uterus.
And that just washes the embryo out?
Sort of. Gentle massage on the rectum helps distribute the fluid everywhere inside the uterus. Then, the fluid is allowed to drain back out through the catheter, but it goes through a very fine inline filter.
Ah, the filter catches the embryo.
That's the goal. And you usually repeat this infusion and draining process maybe 2 to 4 times to maximize the chance of recovery.
Sounds incredibly delicate. What happens to the donor mare after all that?
Good question. Afterwards, she often gets another quick uterine rinse, just with sterile saline, to clear out any leftover flush medium. Then she typically gets a shot of prostaglandin.
Prostaglandin. Why?
That helps break down the corpus luteum, the structure that maintains pregnancy hormones. Basically, it brings her back into heat quickly, so she can potentially be bred again for another ET cycle, or just go back to her normal cycle. Sometimes antibiotics or anti-inflammatories too, just as a precaution.
Okay. And meanwhile, someone's searching that helter.
Exactly. The Clickett's fluid in the filter is taken straight to the lab and meticulously examined under a stereomicroscope. You're literally looking for that tiny, tiny dot.
Must be like finding a needle in a haystack.
It takes skill and patience.
Yeah.
Once found, the embryo is carefully picked up, evaluated for quality. They use a grading system. Grade 1 is excellent, grade 4 is poor, and then washed through special sterile holding media to keep it safe. Sometimes, you might find unfertilized eggs instead.
Right. Doesn't always result in an embryo. Okay, so that's the donor side. What about the recipient mare? The surrogate mom, how do you pick her and get her ready?
The recipient mare management it's just as crucial, maybe even more so for the pregnancy stick. The ideal recipient is, well, reproductively healthy, obviously, fertile.
Makes sense.
Usually between 3 and 15 years old. Ideally has carried a foal successfully before. Good body condition, good temperament, that helps later. And similar size or slightly larger than the donor mare.
And she gets a checkup too.
Oh yeah, definitely. A full breeding soundness exam for her as well.
Mm.
You want to make sure her uterus is a perfect environment.
Okay, and this is where that synchronization you mentioned earlier comes in, right? The sources really emphasize this part.
They absolutely should. It is the most critical step. The recipient mare's cycle, specifically her ovulation, must be closely synchronized with the donor mare's ovulation.
How close are we talking?
Super close. Ideally, the recipient ovulates 1 or 2 days after the donor ovulated. That seems to be the sweet spot. Though, a slightly wider window, maybe 1 day before the donor up to 3 days after, can sometimes work. But success rates might drop a bit.
How do they even manage that kind of timing?
Hormones. Carefully timed protocols using things like prostaglandin, progesterone supplements like Ultranogest, sometimes GnRH or HCG, to induce ovulation precisely. Because getting that timing perfect is so vital, and not every mare responds exactly the same.
Yeah.
Most ET programs will synchronize 2 or 3 recipient mares for every 1 donor mare being flushed.
Ah, to increase the odds of having at least one perfectly synchronized recipient ready when that embryo is found.
Exactly right. It gives you options and maximizes the chances of a successful transfer into the best possible uterine environment.
Okay, so you've got the embryo, it's good quality, and you've got a perfectly synced recipient mare. How does the actual transfer happen? You said it's usually non-surgical now.
Yes, non-surgical is definitely the standard today.
Yeah.
It's much less invasive. The embryo is carefully loaded into a very thin, sterile instrument, basically a specialized pipette inside a protective sheath.
Okay.
After cleaning the recipient mare, the technician passes this instrument through her cervix. Usually they guide it with one hand via the rectum using ultrasound or just feel to place it correctly.
Wow.
And then the embryo is gently, very gently, deposited into the uterine horn, specifically on the same side where the recipient mare ovulated.
So you're putting it right where it needs to be, like planting a tiny precious seed.
That's a perfect analogy. Surgical transfer used to be done, sometimes making an incision in the flank, but it's much rarer now because the non-surgical method works so well and avoids surgery risks, only maybe in very specific, difficult cases.
What about storing embryos? Can you freeze horse embryos like you can, say, cattle embryos?
That's been a bit more challenging in horses, historically. Fresh transfer, meaning collecting the embryo and putting it straight into the recipient almost immediately, gives the best results. That's the most common way.
Okay.
You can cool embryos in special media and ship them overnight, so the collection might happen at one clinic and the transfer at another facility the next day. Success rates are generally good, maybe slightly lower than fresh.
And freezing.
Freezing, or cryopreservation, has been tricky. Horse embryos are relatively large compared to other species, and they have this unique outer layer called a capsule that makes them sensitive to traditional freezing and thawing. Success rates used to be quite low.
Used to be. Is it getting better?
Yes, significantly. New techniques, especially one called vitrification, which is like flash freezing, extremely rapid, are really improving the survival rates of frozen thawed horse embryos. It's making freezing a much more practical option now for long-term storage or, say, international shipping.
That's a big development. Okay, so the embryo is in the recipient mare. What happens next? How do you care for her?
Post-transfer care is absolutely vital for maintaining the pregnancy. Number one is usually progesterone support.
More hormones?
Yeah. The recipient mare gets supplemental progesterone, usually in oral form like Altranagest. Brand name Rigumete is common, given daily. This helps support the early stages of pregnancy, typically until she's about 100 or 120 days pregnant, when her own body, or rather the placenta, takes over progesterone production.
Okay, progesterone support. What else?
Keep her stress low, a calm environment, limited strenuous exercise, especially early on. Let her body focus on the pregnancy, and then monitoring with ultrasound.
Checking if it worked.
Exactly. The first pregnancy check is usually done pretty early, maybe 6 to 8 days after the transfer, which corresponds to when the embryo would be about 14 to 16 days old from ovulation.
What are you looking for then?
Confirming there's a pregnancy vesicle, checking it's the right size for its age, and making sure there aren't twins, which could happen if the recipient ovulated twice herself, although that's uncommon with careful management.
Right. And after that first check?
More checks. A crucial one is around day 25 to 30 post-ovulation to look for the fetal heartbeat. That's a big milestone. Then another maybe around day 40-45 to confirm viability before these structures called endometrial cups form, which play a role in hormone production.
And then just regular broodmare care.
Pretty much.
Yeah.
After those early checks, she's managed like any other pregnant mare. Good nutrition, routine vaccinations, deworming schedule. Her health is obviously paramount for the foal's development.
And speaking of the foal, just to be crystal clear, genetically it's entirely from the donor mare and the stallion, right?
100%. The recipient mare provides the uterine environment, the nourishment, the birth, and all the maternal care nursing, raising the foal, but she contributes zero genetic material. The foal is the donor mare's and the stallion's offspring.
Okay. And registration, any special hoops to jump through?
Yes, that's important. Most breed registries, like the AQHA or USEF for sport horses, allow ET foals, but they have specific rules. Usually, you need to enroll the donor mare in their ET program, pay fees, and crucially, the foal must be parentage verified.
DNA testing.
Exactly. DNA from the donor mare, the stallion, the foal itself to prove its pedigree before it can be registered. So breeders need to check their specific registry's requirements carefully.
Okay, this whole process sounds incredibly precise, very managed, but also like there are a lot of places things could go wrong. What are the odds of success, really? What influences those odds?
You're right, there are many variables. Let's start with the donor mare herself. Big factors are her age and reproductive health. Younger mares, say under 15, who are reproductively sound, generally give you much better embryo recovery rates. And better quality embryos, too.
And older mares. Or ones with issues.
Rates drop off significantly, especially over 15 or 20 years old, or if she has underlying fertility problems like chronic uterine infections, cysts, scarring. That makes it much harder to get a good embryo.
Oh,
Also, as we mentioned, flushing on day 7 or 8 usually gives the best results compared to, say, day 6.
makes sense. What about the stallion? Does his fertility matter?
Absolutely. Using a stallion with proven high fertility definitely helps achieve better fertilization rates in the first place. Using frozen semen, while effective, often results in slightly lower fertilization rates compared to fresh or cooled semen. So stallion choice matters.
Okay, donor factors, stallion factors. What about the recipient mare?
Huge factor. Her overall health and reproductive soundness are critical, of course. But the absolute key, as we keep saying, is that synchrony. Getting her ovulation time just right relative to the donor is paramount for the embryo implanting successfully. And naturally, embryo quality itself, a grade 1 embryo has a much better shot than a grade 3 or 4.
And the vet's doing the work.
Oh, definitely. The skill, the experience of the veterinary team, the quality of the clinic or the program, that makes a huge difference. Well-managed programs with experienced staff and, ideally, a large pool of recipient mares to choose from generally have higher success rates.
So putting all that together, what are some typical numbers if everything goes reasonably well with a healthy young donor?
Okay, so for embryo recovery per flush attempt from a healthy, fertile young mare, you're often looking at maybe 60 to 75%, which is actually pretty similar to her chance of getting pregnant naturally in a single cycle. But again, that number drops a lot for older or subfertile mares.
Okay, 60–75% chance of getting an embryo. Then what about getting a pregnancy from that embryo?
Once you have a good quality embryo, say grade 1 or 2,
Yeah.
and you transfer it into a well-synchronized, healthy recipient, the pregnancy rate is usually quite good. Often 70 to 85% confirmed pregnant at that first check, around 14–16 days.
That's pretty high.
It is. The transfer itself, done well, is quite efficient. So when you combine those probabilities, the chance of getting an embryo and the chance of that embryo resulting in a pregnancy sequence, the overall live full rate per cycle for a fertile young donor in a good ET program often lands somewhere in the 50 to 70% range.
So comparable to, or maybe even slightly better than, trying to breed her naturally for one cycle.
Often very comparable, yes, which makes it a very effective strategy, especially considering the other benefits like her staying in competition.
And those frozen embryos you mentioned with the improving vitrification, what are their rates like now?
Still generally a bit lower than fresh or cooled. You might see pregnancy rates per transfer in the 40 to 60% range with good vitrified embryos, but it's more variable. Depends heavily on the lab, the technique, the specific embryo. But it's definitely improving and becoming more reliable.
Okay. It sounds promising, but are there downsides? Complications breeders should be aware of?
Yes, like any procedure, there can be potential issues. For the donor mare, repeated flushing can sometimes cause temporary uterine irritation or inflammation, endometritis. Good technique minimizes this, but it's possible.
Does it affect her future fertility?
Some studies suggest that lots of flushing within one season might slightly reduce her natural conception rates later that same season, but it generally seems to be temporary. Long-term impact seems minimal if managed well.
What about the recipient mare?
Well, she can still experience pregnancy loss, just like any normal pregnancy. Early embryonic death, abortion. Those risks still exist. Very rarely you might have a mare that doesn't display good maternal instincts, but careful selection of recipients usually prevents this.
And for the foal itself, any risks associated with being an ET foal?
Generally, ET foals are considered just as healthy as naturally conceived foals if the recipient mare is healthy and provides good nutrition and care. Early embryonic death or abortion rates might be slightly higher in some studies, but major developmental issues are rare. Twinning, as we mentioned, is a possibility if two embryos get transferred or if the recipient produces her own twin alongside the transfer.
Gotcha.
Yeah.
Any other practical points people should consider?
Definitely. Sterility is paramount. These procedures, especially the embryo handling, need to happen in a very clean, often hospital-like setting to prevent infection.
Right.
Checking progesterone levels in the recipient mare both before transfer and at early pregnancy checks is pretty common practice just to ensure she has adequate hormone support.
Okay.
Also, while scientists have tried to get mares to superovulate, produce multiple eggs at once like cattle do using hormones like FSH, it's proven really challenging and inconsistent in horses. It's not a standard part of equine ET like it is in other species. And communication. Clear, constant communication between the owner, the breeding farm managing the donor, the clinic doing the collection, and the facility doing the transfer is absolutely essential for coordinating everything.
Logistics sound key.
Hugely important. And finally, just to reiterate, always check the specific rules of your breed registry regarding ET before you start. Not all registries accept it, or they might have very specific requirements.
Okay, wow. So summing it up, equine embryo transfer, it's clearly this sophisticated, really valuable tool for breeders, isn't it?
Absolutely. It offers these unique ways to maximize a mare's genetic potential. Lets her keep performing, helps overcome fertility hurdles, allows for more foals.
But it definitely requires that meticulous veterinary management, careful planning, and I imagine a significant financial investment too.
No doubt about it, it's commitment.
Yeah.
But the results can be revolutionary for a breeding program.
Thinking about all this precision, all this control involved in ET, it makes you wonder, what are the broader implications? How does it change how we even think about natural breeding?
That's a fascinating question, isn't it? And looking forward, as technology like vitrification gets even better, how might practices like ET continue to reshape the genetic landscape? Especially for desired traits in performance horses, or maybe even for conserving rare breeds or related species.
Pushing the boundaries of what's possible in animal breeding. Maybe even conservation. Lots to think about there.
Definitely something to mull over until our next deep dive.